I want to go over a cool patient case of someone who is taking 15 milligrams of Zepbound and had plateaued. This is a woman in her 30s on 15 milligrams, hadn't lost weight in the past 3 months. She was still in the high 20 BMI range, 27 or 28, and wanted to get down still, lose a little bit more weight. However, recently she was feeling a little bit of the meh. That means like anhedonia, a little bit of just very mild depression. And there was thought that it may be from the medicine, and there is biological plausibility that these medicines kind of dampen down that dopaminergic system in our body, which can be good in a little bit if we are just kind of overly stimulated, kind of addictive like tendencies, alcohol, gambling, all those things. We're starting to see that these drugs may have an effect there. But sometimes it dampens it too much, and we see people kind of not getting pleasure from the things that they enjoyed before. If this is you, make sure you comment. Well, what we did was we went down to 10 milligrams of Zepbound, so going from 15 to 10. Now, most people would feel like, oh, that's not good. They're not going to lose any weight. But she was complaining that she wasn't able to feel like working out anymore. She didn't feel like doing anything, despite being at that max dose of tirzepatide, Zepbound, and not losing weight. So what I did is I also added a little bit of bupropion. She had been on bupropion years in the past. So I added 150 milligrams of bupropion extended release. 3 months later, I just had the appointment, and I was just enamored the whole time listening, because I thought, like, yeah, maybe this will have a little bit of effect. Hopefully she does okay with it. What she described was amazing. She said she'd lost 10 pounds in the past couple months, and her wanting to do things like pleasure, going out and working out, she just said she felt great, and the scale was moving again. So we went down in her dose of tirzepatide, Zepbound, and she'd been plateaued. She lost more weight, and now she was feeling great again and enjoying her life. So again, I'm not playing TikTok doctor or Instagram doctor or whatever doctor on social media. You got to have your own doctor do this. And of course, you can come see us at Vineyard, where we do this type of thing. We go deep in it. We don't just prescribe the medicines and set you on your way and not really talk to you. We go deep and kind of figure these cases out. So if you're feeling this way, you have a little bit of that meh from the medicine, it's worth discussing changing the dose. Maybe you need to add in bupropion, but this is something I see not super rarely, and not super commonly, but enough to where people need to know about it.